I'm Dr. Nancy Allen. I've been a practicing doctor for 25 years. I'm a GP by profession and I specialise in the menopause and perimenopause. I'm also a healthcare spokesperson and I've been on national TV, Channel 4 News, GB News, Sky News, and numerous podcasts. So medicine is my passion and I've dedicated my life to medicine. Being a doctor was a calling I had when I think I was about 4 years old. I saw a little bird that was on the road and I picked it up, took it home, nursed it, and it just flew out. And it was the most rewarding feeling to heal that little bird. And my dad was a biochemist. He used to take me to the labs with him, and I used to be fascinated by all those busy important people running around in hospital. And I thought, that's what I want to do. The thing I love about dual practice is that you never know what's coming through the door, and it's challenging. And the other thing that I love generally is the breadth of knowledge. So all the specialists refer to us, the patients come to us first, and then we decipher what the problem is, and then we can then make a specialist referral. So layer on top of that, my expertise in menopause. Not everybody who comes to me has pure menopausal symptoms, so I'm able to support them through whatever they come with, and I have an overall holistic view with my GP hat on, and it's very, very rewarding to see that transformation in people, and we come to an agreed treatment protocol. It's just the most rewarding thing on earth to see somebody walk out being healed and cured and finding themselves again. I genuinely love helping people, and I've worked incredibly hard. It took me, 13 years to get my GP qualifications. I'm a GP tutor and I've been training generations of doctors over the years. I'm an examiner, and I feel extremely privileged to have this knowledge. And on top of that, the knowledge of menopause. I also do ADHD in the background as well. But it's so rewarding to actually help people and help them see what the issue is and help them put them in the right direction and give them the best evidence-based medicine and have an open discussion. So I love being challenged. I was born in Glasgow and I grew up in the northwest of England. They come in and they sometimes get really worked up and think they're going to have a battle, or they have time to talk to me or, get the message across. But a lot of people say to me that I'm very, very approachable. I listen, and I think after the treatment protocol, I find it life changing. And that word life changing is a common theme of feedback that I've always got back, and it's just rewarding. I feel I've done my job and I've served my purpose. I think of my specialty, I really enjoy it. There's so much knowledge out there and keeping up to date with everything. And I'm proud to be an upstanding member of three amazing organisations. Not only the British Menopause Society, the European Menopause Society, and the International Menopause Society. And it's quite unique then. I go to these international conferences, they all have a different angle where European medicine is quite different to British medicine, and then you've got the International Menopause Society, and they just have a different take. And obviously, in the UK, we have a very cosmopolitan society, and I get people from different backgrounds and they have different expectations. And I'm able to marry medicine, British medicine, with European and international medicine and meet people's expectations. So it's quite an eye opener. And I will say to them, yes, I know that in Europe this is what they do, and I understand that in America this is what they do. And I'll try and marry all three and meet their expectations. And I'll say to them, this is what we do in England, and this is why this is a rubbing point for you, and I'll explain to them our background in British medicine and how things work. But it can be a challenge sometimes meeting expectations, because sometimes people will listen to podcasts from America and expect that in the UK we have different medicine. Our protocols here are quite different, but that can be a challenge, but I'll embrace it, and I'll just love an open dialogue with my patients. Don't use it, we'll lose it. So if you have a problem, sort it out. A stitch in time saves life, and put your health first. That's my mantra.